Hi, so let's review the cornea. The cornea is the front window of the eye, and what I specifically want to talk about today is the shape of the cornea and how it affects our vision after cataract surgery. So the cornea, when there's zero astigmatism present, will be round like a basketball. If there's astigmatism present in the cornea, then we explain it by saying that the cornea is more football shaped. So astigmatism that is regular means that the top of the cornea is just as steep as the bottom. So the steepness is the same, so think of a football. So that's regular astigmatism. Irregular astigmatism is when parts of the cornea are steeper than other parts. And most commonly, there are conditions that can be inherited in the genes where the bottom part of the cornea is steeper than the top. So think of a valley and then a mountain peak. So the reason this can cause a problem with cataract surgery is that a lot of patients may go most of their lives and not realize that they have this shape to their cornea. Now, people who have it in a very severe form will usually start presenting in their late teens or early 20s. And this condition, one of these conditions called keratoconus, can be something that is progressive unless it is caught and treated. And so, yes, there are treatments for progressive irregular astigmatism. But if it's very mild, a person may make it into their 60s or 70s and not know that they have this condition unless they've seen a corneal specialist and had a cornea map performed, had that test done. So let's say you come in for a cataract surgery. You come into my office because I'm both a cataract surgeon and a fellowship-trained cornea surgeon. It's part of my routine protocol to take a picture of your cornea and look at the shape, because that helps me know how I plan for your surgical outcome. So if a patient has undiagnosed or undetected mild inferior steepening of the cornea that they've gone their whole life and not known they had, they will know it after cataract surgery. And so it is important that the doctor talks to the patient and identifies this prior to surgery. So how will they know it? Well, like we talked about in a previous video, when we do cataract surgery, we take a structure out of the eye called the lens. And that lens is clear when we're babies, right? And if you haven't watched that video, check it out for the explanation on what a cataract is. But it gets cloudy. That lens gets cloudy as we get older, and that's what we're calling the cataract. So when we do cataract surgery, this structure that sits inside the eye, okay, here's our cornea back on the front. Got the reflection from my ring light, but here's our cornea, and then inside the eye is the lens. So when we do cataract surgery, we're taking this structure out. We make a very small incision. In my hands, it's a 2.2 millimeter incision, very tiny. And we enter the eye, we go through the pupil, and we remove this lens. And then we replace it with an artificial lens implant. And again, in that prior video, we saw a giant version of what these implants look like. So now, it so happens that the natural lens of the eye that forms the cataract, okay, this is how nature works in a lot of cases. This is how phenomenal our eyes are. Mathematically, the shape of this lens often cancels out the abnormal shape of the cornea, okay? When we take this out, the abnormal shape of the cornea then becomes apparent to the patient. So that irregularity, that irregular astigmatism can be a bother for the patient. So after surgery, if the surgeon hasn't identified and discussed with the patient the abnormal shape of the cornea ahead of time, the patient will come back with their new lens implant in the eye, and the lens implant power not made to correct the astigmatism that is present in the cornea. The patient will come back unhappy with their vision, and they'll say, hey, everything is blurry, I can't see, I didn't think I was going to need glasses, and then this photograph is taken and the mapping is shown to the patient and the problem identified. During surgery, we can treat this astigmatism in the cornea with a lens implant that corrects astigmatism. So it's very important that patients are told about this, because these implants that correct astigmatism can be placed in the eye to correct the abnormal shape in the cornea, so that, again, you can think of them mathematically crossing each other out, so then the patient sees clearly. And most of the time when patients are in their 60s and 70s talking about cataract surgery, they're past the stage where this cornea is going to continue to worsen. Okay, this progressive condition, keratoconus being one example, typically worsens in the 20s, 30s. Unless a patient is rubbing their eye, we don't typically see progression of this condition when people are older. The cornea is pretty stable. So the doctor can plan to put a lens implant inside the eye. Again, think of these like permanent contact lenses that have a prescription in them. We can put an astigmatism correction in this lens and put this inside of your eye to permanently negate the negative effect of the astigmatism that's coming from the abnormal cornea. So I see patients for this all the time. And once they come to me, they're usually coming or referred in because they're unhappy with their vision after cataract surgery. And I find that the cornea problem was not found prior to surgery. And then afterwards, after the lens implant has already been placed, we don't like to remove these lens implants if we don't have to. So the lens implants that are placed in the eye, they can be removed and exchanged for others, but it's only pretty easy out to about a year after surgery, and we don't like to take these out and do what's called a lens implant exchange after the surgery, after the lenses have been in there for about a year, because the complications just increase. It can be done, every case is different, but the important thing is that the surgeon identifies the issue with the cornea and offers the patient an astigmatism correcting lens prior to doing the surgery. Again, if you don't know what a cataract is, watch my video on what a cataract is, uploaded just prior to this one, and like and follow my channel for all things related to the eye. Bye.